So before we begin our first panel presentation, I have the honor of presenting this year's American Academy of Nursing Outstanding Leadership Award. This distinction recognizes an honorary fellow for exemplary service and perseverance as a champion for the nursing profession. I am proud to bestow Dr. Carolyn Clancy with this award. She is a true leader in improving healthcare quality and patient safety as a highly experienced and nationally recognized physician executive, general internist, and health services researcher. Dr. Clancy serves as the Assistant Undersecretary for Health in the Office of Discovery, Education, and Affiliate Networks at the Veterans Health Administration. Dr. Clancy is an eminent researcher in healthcare quality and patient safety, examining disparities in care, access to care, and the impact of financial incentives on physicians' decisions. As director of AHRQ, she demonstrated exceptional leadership and initiated the first annual report to Congress on the healthcare disparities and healthcare quality. Prior to her current position, she served as the acting Deputy Secretary of the Department of Veterans Affairs, where she oversaw the development and implementation of enterprise-wide policies, programs, activities, and special interest. Dr. Clancy also served as the Veterans Health Administration Executive in Charge, with the authority to perform the functions and duties of the Undersecretary for Health, managing the delivery of care to more than 9 million enrolled veterans. In her current role at the Veterans Health Administration, Dr. Clancy fosters collaboration and knowledge transfer with facility-based educators, researchers, and clinicians within the VA and between the VA and its facilities. In addition to her VA position, Dr. Clancy holds an academic appointment at George Washington's University School of Medicine and serves as Senior Associate Editor of the Health Services Research Journal. Since Dr. Clancy's induction as an Honorary Fellow in 2013, she has been a strong supporter of the organization's work, most recently serving as a key member of the Have You Ever Served in the Military Task Force. It is an honor to recognize her impact and commitment as this year's recipient of the American Academy of Nursing's Outstanding Leadership Award. Dr. Clancy, if you could please join me.
Wow, thank you so much. I don't really have adequate words to express my appreciation. Just looking around this room, I see so many nurse leaders who I've known throughout the years who have been enormously helpful to me. And to get the award from someone from Madison, Wisconsin will make my husband very, very happy. He thinks of Madison the way my family, when I was growing up, thought of Rome. I'll just leave it at that. The center of the universe that is meaningful. You know, I look back at my younger self, and I made a lot of mistakes, and many of them I've committed to amnesia. However, one thing I always knew from the earliest days was that for navigation and translation, find a nurse. When I was a student, when I was an intern and resident, when I was an attending physician, in research, teaching, invaluable partners. So when I think of how many nurses have just been amazing in my own career, the list is just infinite. It was a nurse who persuaded me to come to VA to do something very different than I had been thinking about when I left the Agency for Healthcare Research and Quality, and she was right. She is a relative, but never mind. And it was exactly the right decision for me. And the nurses at VA, I am so, so proud that I believe 8 of them are going to be inducted as fellows this year. So this is a glorious moment for me personally. It is not such a glorious moment for lots of us. Listening to the last presentation, psychological safety, moving to higher ground, that definition has shifted a lot for many of us, just because much of what we hold to be very, very important, whether that's evidence, a focus on high quality, scientific endeavor, and so forth, public health, is now questioned in ways that it hasn't been possibly in our lifetimes. And the impact on so many Americans, I think, is going to require that this incredible title of this conference is made real by all of you, by all of the people that you teach, work with, and so forth, because the impacts on so many of our fellow citizens are going to be pretty profound if we're not all actively engaged. I know from your endeavors creating policy to help people, the navigation, the integrity and trust, that you will live up to that challenge. And that gives me enormous hope and optimism, but it is going to be a tough struggle, and it's not going to be a fast one, I don't think. To close on a higher note, I do want to thank from the bottom of my heart the Academy's efforts that have been ongoing for years, recently updated, in terms of making it very real and practical for clinicians of multiple disciplines who happen to see veterans to understand what that means. And I do want to recognize a former colleague who I think I saw in the audience, Dr. Linda Schwartz, who served in the Obama administration with me at VA, who was quite insistent on this. And I think that we're making real headway. I think we've come a long way from the days when I was a student and we would always ask people, did you serve in the military? And we either got a yes or no answer. What we didn't know was what was the next question. Thanks to the materials that the Academy has developed, now people can know the next question and what to ask. And frankly, we have more resources to help so many of those veterans. So from the bottom of my heart, thank you for this recognition. It feels highly undeserved, but I'm still thrilled beyond belief. Thanks so much.